and also South Africa are experiencing the fourth wave of the COVID-19, and also we are expecting that this Christmas some measures will be put in place to address any risk of spiking cases. Dr. Patrick Kumar Boaje, who is the Director General of Ghana Health Service, is here to make a comprehensive presentation on measures that government has put in place to address any possible spike in cases. Also, the government has chalked some successes in terms of the vaccine program that we rolled out, and he is here to tell us all about it. Before I yield the podium to Dr. Patrick Kumar Boaje, permit me to acknowledge some dignitaries who have joined us this afternoon. We have Dr. Dennis Laye, Acting Head Disease Surveillance. Also, we have Dr. Da Costa Aboaje, Director for Health Promotions. Dr. Kwame Amponsa Achiano, Head Expanded Program on Immunization, EPI. Dr. Franklin Asiedu Bekwing, Director Public Health. Dr. Francis Kasolu, World Health Organization's Representative, Ghana. Dr. Anthony Nsian Asari, Presidential Advisor on Health. And we have, of course, the man himself to give us today's presentation, Dr. Patrick Kumar Boaje. So we will yield the podium to him, after which we will come for your questions. Good afternoon.
Thank you very much, Honorable Deputy Minister. WHO Country Rep, Dr. Francis Kasolo, Presidential Advisor on Health, Dr. Anthony Nsian Asari, Directors of the Ghana Health Services, and all present here. I'll give you a brief update. Starting with the update, talk about the situation of vaccination and also our borders and how are we preparing for Christmas and what is the outlook for that. And then also end up with some proposed mandates, which I'll give further explanation to. As far as the overview of the situation is concerned, our Greater Accra still remains the hotspot, and we can see that of the active cases, they account for nearly half of the total active cases so far. So that still remains a hotspot. Currently, we have been a significant decline in cases over the past 2 months. But as we keep saying, we have been here before. A few new cases are on admission. We have increased number of cases among the international travelers for the past 2 weeks. And I'll go further, delve into that further. Increased availability of vaccines, especially in the last 4 weeks, we've received a significant number of vaccinations. And one of the worrying issues is that adherence to protocol is still very, very low across the country. What's our current situation as far as the numbers are concerned? We have a totally confirmed cases of 131,082. We've done about 1.98 million tests so far since the beginning of the pandemic. About 129 of the 131 have recovered. We are reporting a total death of about 1,220, with the current active case of 22, severe cases of active case of 713, severe cases 22, and currently we do not have anybody in a critical situation in our facilities. I think this is just the usual epic curve. You can see that we go up and then we finish the third wave and we are still down. But we should not fool ourselves thinking that we are out of the woods. We've seen it go up again. Obviously, it goes with the 7-day moving average, which has significantly declined under the current situation. And of course, the active cases are also very, very down. So what has happened at the Kotoka International Airport and probably other ports? We have done a total test of 629,831, and we have recorded 33,093 positives with a positivity rate of 0.48%. There has been a surge of cases, mostly among Ghanaians who participated in international religious conference, but broadly there has been a marginal increase in the numbers in November. So the cases we have recorded in November 2021 is compared to 2020 is higher. And the next chart shows you that if you look at the cases, you can see that in November this year, at the end of the month, we have recorded 168 positive at the airport. In 2020, November, we already 21, we have reached 205. And the month, we still have some 2 days or 3 days to go. So that is a significant signal that we cannot take for granted. So that's the situation at the airport, and also mimics what is happening outside. You can see that there's surges in Europe and some parts of the world, and so the airport test continues to pick these signals, and I think it's something we must take. It's just a warning for us to see that these are times we need to be more careful. What we keep saying is that the fact that some of the people who have come in may have been incubating, and that is a clear fact, so we need to ensure that we remain more alert. I want us to have some short chat on the vaccination, which is the most critical intervention we are currently doing. So far, as you are aware, we have about 5 vaccines registered in the country: AstraZeneca, Moderna, Pfizer, Sputnik V, and Johnson & Johnson. How many have we received so far? Since the beginning of the pandemic, we have received about 12,327,000 doses of vaccines of various types. AstraZeneca accounting for about 45% of all received, Johnson & Johnson 19%, Moderna 10%, Pfizer 24%, and Sputnik V 0.2%. So that is what vaccines we have currently in stock. But in the last 4 weeks, we are receiving a significant number of vaccines. As the chart shows, you can see the numbers that has come in. But in the last 4 weeks, we had a significant number of inflows of vaccines. That's why you see that our stock level is still high, because they have just arrived. But what's the pipeline? The pipeline also assures us of more than 7.4 million doses that are supposed to come in between now and probably December. And we may even get more than what is. This is what we know, but we also get others that come in over time. And that will take us about 20 million doses of vaccines that we have received in the country before the end of the year. What is left is for us to take it. But why should we take vaccination serious? I'm sure we have listened to international data, TV reports about the importance of vaccination, but also in Ghana. We did some tests. If you look at the vaccination status at the KIA, despite the low percentage of COVID-19 among international arrivals in Ghana, positivity rate at KIA is 0.6 compared to 6.6% of tests. And there are still significant differences in the percentage based on the vaccination status. Among all those who are vaccinated for COVID-19 was 0.42%. The unvaccinated passengers was positive for 1.27%. When you compare the two groups, what it means is that that person who is not vaccinated is 3 times more likely to be positive than the one who is vaccinated. And so that tells you that even for those who are being tested at the airport, the significant number are the unvaccinated who are testing positive, are the unvaccinated and not the vaccinated. Additionally, information from Ghana Infectious Disease Center also shows that among the severe and critical cases administered to the Ghana Infectious Disease Centers, nearly 98% were unvaccinated. That is those who were admitted, who were seen. That the persons who were, these people who were unvaccinated were 30 times more likely to have a severe or critical case compared to the unvaccinated cases, which means that of the people who got positive and were admitted, 97% were unvaccinated. Among the COVID-19 deaths in the Ghana infectious disease, in a particular month where we had 16 deaths, 2 amounting to about 12.5% were vaccinated. But these 2 people had severe underlying medical conditions. That still tells you that the fact that you may be infected, but the fact that you get hospitalization and die is higher if you are unvaccinated. The rest of the 86%, as we said, were vaccinated, were not vaccinated. That's unvaccinated is 7 times more likely to die from COVID than the person who is vaccinated. And that's why vaccination is extremely important. How have we deployed our vaccines? We have a target of 20 million, as was said by the president, by the end of the year, and we're still working very hard towards that. At least you have the vaccines to do that. 20 million of the, excluding the children 16 and below, but now that we have updated it, we have gone to 15 years and above. Our vision is to vaccinate the entire population, including the children and the pregnant women, as more safety data becomes available. That's why we started with 18 and above. But when safety data became possible that we can go, for Pfizer can go even up to 12, we have moved it down to 15 so that we can reach more of them. Our strategy remains the same. One is to static, that is where facility by facility, almost all our facilities are providing vaccination. We are doing outreach. We are going around from place to place to take the vaccine to the people. We are doing mobile vaccination. People will go to the lorry parks and see a car park, they're doing vaccination. We are doing camp out. There are some places, if you go to Kwame Danso area and the overbanks, you can't go and come the same day. So the team go there, set up a camp in these places, riverine areas, and stay there and vaccinate people, and a combination of them. Currently, what we have been doing is, you can see that we are taking the vaccines to the people. We are doing schools, going to schools to vaccinate, universities, etc. We are going to workplaces. I remember we went to Aviance recently and vaccinated almost 600 of them. We are going to churches and mosques. As we speak now, there are vaccination centers in churches today. We are going to lorry parks and markets to vaccinate people, sports stadia, Takoradi, among places where they are camping out, vaccinating before you enter, and when they leave, those who want to vaccinate are given, and house to house when it comes. I know that for some of the areas in Accra, they are doing house to house. In our villages, they are doing house to house to ensure that more people are vaccinated. So in all, we have done about 5.41 million people have been vaccinated. Like I said, we have the vaccines there. We've had them the last 4 weeks, and so we're going to ramp up the vaccination. And if you look at the next slide, you can see that the real daily vaccination numbers are soaring. We reached about 142,000 doses a day. And that is how we're going to continue to make sure that we live up to the vaccination. We have a few pictures for you to see. I hope it's big enough. How they are moving to places, crossing rivers to go and look at, going to schools, going to the villages, house to vaccinate people. Going to schools and many places to vaccinate across the country. And that's why we're able to achieve what we are achieving now. Which has led to about 21% of the expected population have been given at least their first dose, and 7% are fully vaccinated. But that is, looking at the way we are ramped up, if the people cooperate and everybody comes for their vaccine, we can significantly meet these targets that we set for ourselves. This 145, we can do 142,000 a day. We can double that. And what we are going to do is doubling our teams to ensure that we do more. All we need is people should come for their vaccine. Our land borders remain closed, and I think remaining on the situation now, it may remain closed. I don't have the power to say that, but at least for now it's closed. We will continue to work closely with immigration and other security agencies to ensure that the COVID-19 cases are not imported through our land borders and our sea borders. We have systems in place to check. Port Health is checking at the border, at the seaports we are checking, and all those who are embarking are tested before they come to. And people who have special permit to go through this, and we ensure that they are all tested before they come. We have sports team coming in, about 600 of them. We test them. At the airport, looking at the situation will remain the same. We're going to be more vigilant. We're going to continue expecting the 72-hour PCR test before you travel to Ghana. You are going to be tested on arrival at the KIA and continue to review the situation until that. But for now, looking at what we are seeing, these protocols are going to remain, and we are actually going to be more enforcement. I think we're going to take a critical look at countries of concern. As things change, if there's a country that we have a real concern, our surveillance will be enhanced to cover that. Now, I think we saw what happened in January, February, and a bit of March in this year. We have to work against that. We have to prevent it, and that's why we are preparing for Christmas. The Christmas festivities that occasioned this. I think the last time it was 28th of December when we started seeing the numbers skyrocketing. We have to all work together to ensure that these things are not done. These surges are anticipated because, one, we are expecting an increased number of people arriving in the country. There is increased global travel with the associated risk of disease transmission. As I mentioned, that is what's happening after Christmas of 2020. And of course, the emergence of a new strain. That also becomes another challenge that should make us sit up more closely. Of course, there's also going to be an in-country brisk activities. People are going to move to Accra, do shop and go and sell. People are trying to round up everything and travel. And so the activities in-country, and then this virus is spread by movement. And so the more you move, the more you interact, the more it gets transmitted. So the Ministry of Health and Ghana Health Service will continue to implement these protocols at the airport and other places. We also have to have strict enforcement on the protocols at the airport, as I mentioned. We are going to increase surveillance, not just at the place, but also to look out for the new strains. We do sequencing, and we continue to do our sequencing, especially in samples in our reference labs, and all those who test positive at the airport, we do sequencing, genomic sequencing for all that. And that is what is going to use to continue our monitoring to see whether, what is our strain? Is there a new strain in? What is the dominant strain? These are areas that is important for our strategy. So in preparing for Christmas, we are going to ensure that we have our logistics are prepared, logistic management, whether test kits, etc., that needed to be able to anticipate any surge, or also continue our surveillance to be able to look at that. We are going to look at isolation centers to ensure that they are ready to take isolation should there be, but that's not what we are. All the work we are trying to do is to ensure that we don't have to isolate too many people, or don't have to treat more people, but that we'll still prepare for that. Our contact tracing will be strengthened and reactivated as we still continue, and our risk communication will be enhanced as we are doing now. We are going to engage religious organizations and other stakeholders on Christmas to ensure that preparation, all these activities, parties are all done in accordance with the protocols to prevent us getting any challenges. We are going to monitor the enforcement of system protocols for such as the mass gathering. We need to intensify that. We are going to work in close collaboration with the security sector to ensure that these protocols are respected. We want to use the opportunity also to appeal to specific institutions to institute and monitor adherence to the protocols at their workplaces, including vaccination mandate. They feel that they have given opportunity to people to say that in this bank, for example, if you are not vaccinated, you can't come. Or if you are going to come, I know banks in the country where you can, if you are not vaccinated, you have to do a PCR weekly to continue coming to work. And these are all additional support that can ensure that we all get protected, because most of our problems start from the workplace. It's like a mass gathering in separate rooms. Once you remove the walls, it becomes a mass gathering. And so we need to take that one quite seriously. So to look at that, I think I'll skip this one as part of the next slide. Yes. So the Minister of Health, who should have been here, has asked that these are the proposed mandates which we are going to pursue. With the increasing availability of vaccines and reasonably quantity in the pipeline, we are declaring December as the month for vaccination, or let's say vaccination for Christmas. So December is going to be declared as the month of vaccination, and to be launched by the Honorable Minister on 30th of November 2021, that's Tuesday coming. These mandates, which I'm going to announce, will be applicable in January 2023 at specific groups and manners as soon as, and this mandate become effective as soon as the campaign is over. We have them in two sections. They are going to have proposed groups that will be covered under the mandate and the venues. We are looking at all the three arms of government. All health workers have been given the opportunity to vaccinate, and they stay in a very strategic position that either they can share among themselves or give to their patients. So that's why we prioritize that. And remember, we are talking about these are the people who have been prioritized at the beginning, even when we had very few vaccines. And so we expect that. All security personnel will be covered. They should be vaccinated. All staff and students in secondary and tertiary schools should be vaccinated. And so secondary schools are being given the opportunity. Started last week, Friday, from 27th, almost all regions are doing vaccination of Pfizer in schools. And so in January, you should be fully vaccinated before you come back to school. All workers in government institutions and parastatals, all commercial drivers and their mates are expected to be vaccinated at the end of that. That's where they're commanded to cover them. There are areas where the mandate to cover, that will be a venue. And this venue for now includes nightclubs, beaches, sports stadium, and restaurants for indoor dining. And these are areas that it will mean that you need to be vaccinated before you can go into these venues, and that will be enforced. So these are the mandates in terms of the group that will be affected and the locations which you have identified are areas that you have to be vaccinated to be able to participate in any event occurring in those places. So what's our look? We have increasing access to vaccines, COVID-19 vaccines. We have some level of people who are still unsure. I don't use the verses, they are unsure. Because what we have noticed is that they may not come, but if the vaccines are taken to them, they take it. So I'll say they are either they don't feel the urgency to go and have the vaccine. But you see, the best time to vaccinate is when you are not sick. I'm just coming from a funeral of my sister. When he got COVID, that's when you're looking for vaccines. Okay? So the best time is to be doing now. not when you have. So the COVID has affected all of us. It's not just for. The current low numbers may not be maintained if vaccine is not, uptake is not increased. So the vaccines are available. It's all of us' responsibility to take it up. We may have, there's possibly fear of a surge after Christmas. But of course, the Christmas, it is, it's after the parties and this thing that it starts. So it will not be a Christmas. You may enjoy a Christmas, but after Christmas, that is when. So we need to be very careful. We are going to take care of our risk communication. We are doubling our vaccination teams. We are moving around more now, and so we are looking for support from all government institutions in the locality to assist these people do the vaccination across. We still have a threat of yellow fever. That may continue to give us a stress. I know it's, I would say technically, under some control now. But these are what we want people to know, that Ghana Health Service is not only doing COVID. We are managing all the things we were doing before COVID. Incidentally, and good news is that all our essential services remain stable, but it may not continue like that if we continue to do what we are doing. So this is my favorite picture. This man is a frontline worker. You can see he's so tired, exhausted. All he's asking is, please wear your mask and get vaccinated so that I can also rest. Thank you very much.
Thank you for the brilliant presentation, Dr. Patrick Kumar-Boaji. Ladies and gentlemen, we will now come for your questions. We will take them in 2 or 3 batches. So kindly show by hand if you have any question. We will bring the microphone to you, and then after 5 questions, we will go to Dr. Patrick Kumar-Boaji for his response. So please, if you have any question, kindly show by hand. Any question? I guess okay. So take the first, then the second question.
My name is Obed. I report for GH1 Television. Now, during the presentation, you mentioned that centers like nightclubs, beaches, and other entertainment centers, they would have to make sure that people are vaccinated before they enter such places. The question is, how really is compliance going to be ensured? Because such places are known for non-compliance. Beach, nightclub. My second question. Land borders are going to be remained closed, but the truth of the matter is that people have ways of still going out of the country and coming in. How are we making sure that such unapproved routes are blocked? Thank you.
Thank you for the question. So we'll take the second question.
Thank you, Doc. My question is simple. The new variant, the Omicron, has generated a lot of heat across the globe. You didn't touch on the variant, if we have discovered or we have any new variant apart from what existed in the country prior to the discovery of the Omicron variant. I would want to find out the status of the variant we have in the system. Yeah. Thank you.
Okay, Nana, we'll take the third question from Nana.
Yeah, Doc, good afternoon. I want to find out why the COVID-19 virus keeps on changing its operations and behavior and things like that, because this particular virus is almost, I don't know how to, but it's like You go to South Africa, it's different. You come to England, it's different. You go to China, it's different. Why that particular? Is it possible in this? Because people are saying that it is either biologically generated or chemically generated. That is why it keeps on changing its behavior. And then my second question: in the annals of medical history, do you have a situation where a pandemic can have a first, second, third, fourth, and fifth wave? Because this virus is having, I think, the fourth wave that we're experiencing now. Is it possible? I don't know. Thank you.
Thank you. Please, we'll take one more question before we go for the rest. Okay.
Mine is still on the proof of vaccination. So if you require proof of vaccination to enter a place, that would be the card. But this is the situation where most people can't even verify the cards. How are we making sure that our vaccination cards are approved? Thank you.
Thank you for the question. So,
thank you. I think I may call on some of my colleagues to assist. How are we going to enforce? I think I mentioned that we'll be working with the security agencies. They are able to come to the beaches. I'm sure that owners or managers of those places will also be held to some extent accountable. So they'll also be part of the system to ensure that people who are admitted into a nightclub or whatever are vaccinated. I traveled out of the country recently. The very hotel I'm staying in, I can't get to the restaurant until I show my vaccination card. Meanwhile, I'm sleeping there. And they're able to check. So, yes, the land borders will continue working through with the distance. But it's closed, and Port Health and Security are making sure that people are not, if you know anybody who has crossed, maybe you should report the person. That's on a lighter note. But I think it's a genuine concern, but I know the security services are working and making sure that. And we have also heightened surveillance. Remember, we have health workers all along every district, that border, and we are doing our surveillance. And you remember, in the early phases, we were intercepting cars that had crossed in and testing them. And so there are ways of getting through them. The Omicron, we have not identified one in Ghana. All people who are tested positive at the airport are sequenced, the samples are sequenced, it's very important, all of them. We also pick samples from our reference labs across the country to do sequencing. Currently, they have a bunch of about 160 that they are working on now, but there's been no indication of Omicron in Ghana. So all those messages flying around is not true. There's no case in Ghana. WR is here, and my Director of Public Health might also talk about additional the Omicron. But the issue about Omicron is that whatever it is, vaccination is key, social distancing is key, wearing of masks is key. So the preventive measures remain the same. We have not had any evidence that it will pass through a different part of what we know now. So all the mechanisms that are in place continue to work. And we also continue our surveillance to ensure that once we discover, we look at that. Maybe the BR can add later. Why variants? I'm sure that's the behavior of all viruses. They continue changing their nature. And especially if it goes unchecked, then they continue changing. If you look at the flu pandemic in the early 1918, it lasted for 4 years. Okay? And there were waves. So this is not too different from that. If you look at the current flu, that is, people are getting jabbed for, the virus continues to change, and so they always continue to update the kind of vaccine they give to them. So it is nothing easy. The card verification, I think the word many is not the truth. There was a gap, there's a batch that had a problem, which we are correcting. When we are asking people to go to your nearest health facility where you took your vaccine, if you check, you verify it does not come, go there and get it verified for you. There were a group who had the opportunity to go for their second dose. That correction was done. We have sites at the airport for people who are traveling to check their verification, and if it's not verified, it's activated for them. So the significant number of people with cards can be verified. It is not the majority. There's a small group that had an initial phase that we had a problem. We are working very hard, and we have actually closed the gap on them. If any of my colleagues wants to add, especially on the new variant, I'll be very happy. So those are my responses. W, I want to say something about the variant.
Good afternoon, dear colleagues. I think just to re-emphasize the points that Dr. Boaji has raised concerning the variants. This is not the last variant that we are going to see. We are going to see variants emerge. But the message that we would want you, dear colleagues from the media, to be propagating is that people need to behave in a certain way. What do we mean? We need to continue wearing masks. We need to continue having the social distancing. We need to ensure that we are washing our hands and sanitizing our hands. But also we need to ensure that if we are not feeling well, especially now that we are all aware of the symptoms that COVID generates, that we stay at home and self-isolate and not suddenly decide you're going to do your shopping now, because you are the carrier of that virus and you'll be spreading it. If you don't feel much better, I'm sure there are facilities, hospitals that you then can report. But if it's a mild condition, try and get yourself isolated. But above all, we've heard about the vaccines. The vaccines are available. We've moved into, you're saying, phase 2. Go and get vaccinated. It's only through getting vaccinated that we will reduce the number of serious infections and so save our health systems from collapsing. Because if we all don't get vaccinated and we start having serious conditions, our hospital capacity will not be able to match the numbers that we have. But for now, let's get vaccinated. Concerning the variant that is circulating, it is brand new news. What we know is very limited. And so I would again urge colleagues not to overblow this new variant as though it's going to cause catastrophe. We are still learning. Even where they've reported it, we are beginning to hear that we may not have the major illnesses that we saw with the Delta variant. So let's really keep advocating for wearing masks and vaccinating, and not overblow the existence of variants. There are so many variants that are going to come up, and I don't know how many times you're going to be writing screaming headlines on these variants. So let's move to the positives and avoid blowing up the negatives. So I'll pause for here. Thank you.
Colleagues, please, if you have any question, we will take another set and then go for responses. If you have any questions. Okay, so if you don't, then we draw the curtain on today's program. I would like to thank Dr. Patrick Kumar Boaji and all the intelligent doctors from Ghana Health Service and other stakeholders in the health sector for joining us this afternoon. Colleagues, thank you for making time to join us. Good afternoon.
Ghana has appointed Professor Ebenezer Oduro-Owusu as the university's new president. Professor Oduro-Owusu was the immediate past